CMA AAMA practice test. Question 1. While reviewing office protocol, a pediatric patient is involved when a blood specimen label is about to be placed on a tube. Which action best prevents patient identification errors? Option A. Use the room number as the only identifier. Option B. Label the tube after returning to the desk. Option C. Ask another patient to confirm the name. Option D. Verify two identifiers such as full name and date of birth before labeling. The correct answer is option D. Verify two identifiers such as full name and date of birth before labeling. Two identifiers reduce the risk of assigning results to the wrong patient and should be checked before specimen labeling. Room numbers, delayed labeling, and unrelated confirmation are unsafe because they can lead to misidentification. Question 2. While following clinic policy, the medical assistant notes that a tympanic temperature is ordered for an adult patient while supporting safe patient care. Which technique is appropriate? Option A. Use the probe without a cover to improve contact. Option B. Position the ear canal according to device instructions before inserting the covered probe. Option C. Force the probe deeply into the ear canal. Option D. Use the same technique for every age without adjustment. The correct answer is option B. Position the ear canal according to device instructions before inserting the covered probe. Tympanic accuracy depends on proper ear canal positioning and a clean probe cover. Uncovered probes, forceful insertion, and ignoring age-specific technique can cause infection risk, discomfort, or inaccurate readings. Question 3. During a walk-in visit, a returning patient is involved when an adult patient has a respiratory rate of 18 breaths per minute at rest for a returning patient. How should this rate generally be interpreted? Option A. It is within the usual adult resting range. Option B. It indicates apnea. Option C. It is always a medical emergency. Option D. It proves the patient has asthma. The correct answer is option A. It is within the usual adult resting range. A resting adult respiratory rate of 18 per minute generally falls within the expected range. It does not indicate absence of breathing, does not automatically represent an emergency, and cannot diagnose asthma by itself. Question 4. A provider asks for assistance because a patient with shortness of breath is waiting to be evaluated. Which position may help breathing while waiting? Option A. Trendelenburg position with the head lowered. Option B. Lithotomy position with feet in stirrups. Option C. Fowler position with the head of the bed elevated. Option D. Prone position with the face down. The correct answer is option C. Fowler position with the head of the bed elevated. Fowler position can promote chest expansion and may ease breathing for many patients with dyspnea. Prone, Trendelenburg, and lithotomy positions are used for different purposes and can be inappropriate for shortness of breath. Question 5. For a patient with a routine complaint in an outpatient setting, a competent adult refuses a recommended injection before documentation is completed. Which action is appropriate? Option A. Force the injection because it was ordered. Option B. Notify the provider and document the refusal according to policy. Option C. Hide the syringe in another medication. Option D. Delete the order without telling anyone. The correct answer is option B. Notify the provider and document the refusal according to policy. Competent patients generally have the right to refuse care, and the refusal should be communicated and documented. Force, deception, or unauthorized deletion violates autonomy and safe practice. Question 6. When preparing safe patient care, a used needle has just been removed from a syringe after an injection for an older adult. Which action is safest? Option A. Place the sharp immediately into an approved sharps container. Option B. Drop it in a regular trash can. Option C. Carry it uncovered to the front desk. Option D. Recap it using 2 hands before disposal. The correct answer is option A. Place the sharp immediately into an approved sharps container. Used sharps should go directly into a puncture-resistant sharps container to prevent injury and exposure. Carrying, recapping with 2 hands, or using regular trash creates avoidable needle stick risk. Question 7. In a medical assistant certification review scenario, a patient is placed on contact precautions for a draining wound. Which PPE is typically expected when entering for direct care? Option A. Sterile gloves instead of all other PPE. Option B. No PPE because drainage is covered. Option C. Only a surgical mask for every interaction. Option D, gloves and gown as indicated by the isolation signage. The correct answer is option D, gloves and gown as indicated by the isolation signage. Contact precautions commonly require gloves and gown for direct contact with the patient or environment. A mask alone, no PPE, or sterile gloves without other indicated protection does not match the purpose of contact precautions. Question 8. In a medical assistant certification review scenario, a patient has symptoms consistent with influenza after the patient asks a follow-up question. Which PPE is commonly used for close contact? Option A, a surgical mask with standard precautions. Option B, a lead apron. Option C, no mask because influenza is not contagious. Option D, only sterile shoe covers. The correct answer is option A, a surgical mask with standard precautions. Droplet precautions help reduce exposure to respiratory droplets during close contact. Lead aprons, no mask, and sterile shoe covers do not address the main transmission route for influenza-like illness. Question 9. When preparing safe patient care, an exam table is cleaned between patients after routine use for a patient in the exam room. Which term describes reducing many pathogens on a surface? Option A, venipuncture. Option B, apical measurement. Option C, disinfection. Option D, transcription. The correct answer is option C, disinfection. Disinfection reduces many disease-causing organisms on surfaces and is appropriate for many non-critical items. Apical measurement, venipuncture, and transcription are unrelated clinical or administrative tasks. Question 10. For a teen patient in an outpatient setting, a disinfectant splashes onto the counter and the medical assistant needs spill guidance while checking the chart. Which resource gives chemical handling information? Option A, insurance aging report. Option B, appointment ledger. Option C, growth chart. Option D, safety data sheet. The correct answer is option D, safety data sheet. A safety data sheet explains hazards, personal protective equipment, spill response, and first aid information for chemicals. Scheduling, billing, and growth records do not provide chemical safety instructions. Question 11. While following clinic policy, the medical assistant notes that a small contained fire is being addressed with a fire extinguisher after alarm procedures for a returning patient. What does the first step in PASS mean? Option A, pull the pin. Option B, pour water first. Option C, prepare billing forms. Option D, push the patient. The correct answer is option A, pull the pin. PASS stands for pull, aim, squeeze, and sweep when using an extinguisher. The other choices are unrelated to extinguisher operation and may delay a safe response. Question 12. For a teen patient in an outpatient setting, a patient reports a severe latex allergy before rooming. Which action is appropriate? Option A, document the allergy only after the visit. Option B, use latex-free supplies and alert the care team. Option C, use powdered latex gloves for a better fit. Option D, ignore the report unless a rash is visible. The correct answer is option B, use latex-free supplies and alert the care team. Latex allergy can cause serious reactions, so latex-free supplies and team awareness are important before care begins. Ignoring the report, using latex products, or delaying documentation can expose the patient to harm. Question 13. A provider asks for assistance because a used venipuncture needle is ready for disposal after the patient asks a follow-up question. Which practice is safest? Option A, place it in a coat pocket until the room is cleaned. Option B, break the needle before disposal. Option C, recap with both hands to prevent leakage. Option D, avoid recapping and dispose of it immediately in a sharps container. The correct answer is option D, avoid recapping and dispose of it immediately in a sharps container. Avoiding recapping and placing sharps directly into the proper container reduces needle stick risk. Two-handed recapping, breaking needles, or carrying sharps in pockets are unsafe practices. Question 14. When preparing safe patient care, a chest lead is being placed during a 12-lead EKG for a new patient. Where should V2 be positioned? Option A, right lower abdomen. Option B, 5th intercostal space at the left midclavicular line. Option C, the 4th intercostal space at the right sternal border. Option D, a 4th intercostal space at the left sternal border. The correct answer is option D, fourth intercostal space at the left sternal border. V2 belongs at the fourth intercostal space on the left sternal border. Right sternal placement is V1, fifth intercostal midclavicular placement is V4, and the right lower abdomen is a limb lead area. Question 15. While following clinic policy, the medical assistant notes that a coagulation study such as patient or INR is ordered. Which tube is typically used? Option A, gray sodium fluoride tube. Option B, yellow acid citrate dextrose tube. Option C, light blue sodium citrate tube. Option D, lavender EDTA tube. The correct answer is option C, light blue sodium citrate tube. Light blue tubes contain sodium citrate and are commonly used for coagulation testing. EDTA, fluoride, and acid citrate dextrose tubes have different additives and are used for other laboratory purposes. Question 16. A medical assistant reviews a case where a fasting glucose specimen is being collected while preparing for provider review. Which tube additive is commonly associated with glucose preservation? Option A, sodium fluoride in a gray top tube. Option B, no additive in a culture bottle. Option C, EDTA in a lavender tube. Option D, sodium citrate in a light blue tube. The correct answer is option A, sodium fluoride in a gray top tube. Gray top tubes commonly contain fluoride to help preserve glucose by inhibiting glycolysis. EDTA, citrate, and culture bottles serve different testing purposes and are not the usual glucose preserving choice. Question 17. During a skills check, the scenario states that a tourniquet has been applied while locating a vein for a patient with a routine complaint. Which practice helps prevent hemoconcentration? Option A, apply it over broken skin for grip. Option B, release the tourniquet within about 1 minute when possible. Option C, leave it on until all paperwork is complete. Option D, tighten it after blood begins flowing. The correct answer is option B, release the tourniquet within about 1 minute when possible. Prolonged tourniquet application can concentrate blood components and affect results. Leaving it on too long, tightening it unnecessarily, or placing it over broken skin can harm the patient or compromise the specimen. Question 18. After confirming the patient's identity, a vein tends to roll during palpation. Which action can improve venipuncture control? Option A, ask the patient to pump the fist throughout the draw. Option B, tap the needle against the vein repeatedly. Option C, anchor the vein by pulling the skin taut below the site. Option D, use the thumb above the puncture site. The correct answer is option C, anchor the vein by pulling the skin taut below the site. Anchoring below the puncture site helps stabilize the vein and improves control. Placing the thumb above the site, repeated tapping with the needle, or ongoing fist pumping can be unsafe or affect specimen quality. Question 19. While following clinic policy, the medical assistant notes that a Snellen chart is used during screening while following standard precautions. Which function is being assessed? Option A, blood clotting time. Option B, blood glucose average. Option C, distance visual acuity. Option D, hearing threshold. The correct answer is option C, distance visual acuity. A Snellen chart screens how clearly a patient sees at a distance. Hearing, coagulation, and glucose control require different tests. Question 20. In a medical assistant certification review scenario, a urine drug screen requires legal chain of custody handling for a patient in the exam room. Which action is essential? Option A, let the patient take the specimen home overnight. Option B, leave the specimen unlabeled in the bathroom. Option C, use a routine sticky note instead of required forms. Option D, document specimen control and signatures at each transfer. The correct answer is option D, document specimen control and signatures at each transfer. Chain of custody documents who handled the specimen and helps preserve legal validity. Unlabeled storage, patient transport outside protocol, or informal notes break the required control process. Question 21. In a medical assistant certification review scenario, a point-of-care test control result is outside the acceptable range while following standard precautions. Which action should occur before testing patients? Option A, throw away the control log. Option B, continue testing because controls are optional. Option C, change patient results to match expectations. Option D, do not report patient results until the control problem is resolved. The correct answer is option D, Do not report patient results until the control problem is resolved. Out-of-range controls indicate the test system may not be reliable, so patient testing should pause until corrected. Ignoring controls, altering results, or discarding records undermines patient safety and compliance. Question 22. During a skills check, the scenario states that a urine specimen cannot be tested promptly for a patient with hypertension. Which action preserves specimen quality according to policy? Option A, refrigerate or preserve it if testing is delayed beyond the allowed time. Option B, mix it with another patient's specimen. Option C, place it near a sunny window to keep warm. Option D, leave it uncapped at room temperature all day. The correct answer is option A. Refrigerate or preserve it if testing is delayed beyond the allowed time. Delayed urine testing can allow bacterial growth or chemical changes, so refrigeration or preservatives may be required. Leaving it uncapped, warming it, or mixing specimens compromises results and patient identification. Question 23. After confirming the patient's identity, a child has injuries that raise reasonable suspicion of abuse. Which action is appropriate? Option A, follow mandatory reporting and office policy immediately. Option B, ask the suspected abuser for permission to report. Option C, post pictures online to get opinions. Option D, ignore it because reporting is uncomfortable. The correct answer is option A. Follow mandatory reporting and office policy immediately. Healthcare workers may have mandatory reporting duties when abuse is suspected, depending on law and policy. Ignoring signs, seeking permission from a suspected abuser, or posting information online is unsafe and inappropriate. Question 24. At a preventive care appointment, a teen patient is involved when specimens need to be spun in a centrifuge after confirming office policy. Which safety step is required? Option A, open the lid while the rotor is moving. Option B, balance tubes of similar size and volume across from each other. Option C, place tubes at random angles. Option D, spin a single tube alone for faster results. The correct answer is option B. Balance tubes of similar size and volume across from each other. Balancing the centrifuge prevents vibration, tube breakage, and equipment damage. Spinning unbalanced loads, opening the lid during motion, or random placement creates safety and specimen risks. Question 25. During a routine office visit, blood cultures are being collected for a patient with a routine complaint. Which step is especially important? Option A, draw through visibly dirty skin. Option B, palpate the site again with an unclean glove after cleaning. Option C, use proper skin antisepsis and avoid contaminating the cleaned site. Option D, skip antisepsis because culture bottles contain additives. The correct answer is option C. Use proper skin antisepsis and avoid contaminating the cleaned site. Blood cultures are highly sensitive to contamination, so skin antisepsis and maintaining the cleaned field are critical. Touching the site again, skipping antisepsis, or drawing through dirty skin can cause false positive results. Question 26. For a teen patient in an outpatient setting, a labeled blood specimen is being sent to the laboratory. Which packaging is appropriate? Option A, tape it to the outside of the requisition. Option B, place the specimen in a leak-resistant biohazard transport bag with paperwork separated as required. Option C, put it loose in the regular mail bin. Option D, carry it open in a coat pocket. The correct answer is option B. Place the specimen in a leak-resistant biohazard transport bag with paperwork separated as required. Biohazard transport bags help contain leaks and keep paperwork protected from contamination. Pockets, taped tubes, and loose mail bin transport create exposure and specimen handling risks. Question 27. A provider asks for assistance because a 12-lead EKG is being set up after the patient asks a follow-up question. Where is lead V1 placed? Option A, fourth intercostal space at the right sternal border. Option B, second intercostal space at the left midclavicular line. Option C, on the right wrist beside the limb lead. Option D, fifth intercostal space at the left anterior axillary line. The correct answer is option A, fourth intercostal space at the right sternal border. V1 is placed at the fourth intercostal space on the right sternal border. The other locations correspond to different chest or limb areas and would distort the tracing if used for V1. Question 28. While assisting with patient care, A sterile tray is prepared for a minor procedure for a patient waiting for the provider. Which action maintains sterility? Option A, turn away from the sterile field for several minutes. Option B, keep sterile items above waist level and within view. Option C, use items from a wet torn package. Option D, reach over the field with non-sterile sleeves. The correct answer is option B, keep sterile items above waist level and within view. Sterile fields must remain visible and protected from contamination. Turning away, reaching over the field, or using compromised packages can contaminate supplies. Question 29. During a skills check, the scenario states that an EKG tracing has wandering baseline and one electrode is peeling away. Which action is best? Option A, reattach or replace the loose electrode after preparing the skin. Option B, tell the patient the heart rhythm is definitely abnormal. Option C, write normal on the tracing without review. Option D, leave the electrode loose to avoid discomfort. The correct answer is option A, reattach or replace the loose electrode after preparing the skin. A loose electrode can cause baseline wander or signal loss, so correcting the connection is appropriate. Diagnosing the rhythm, leaving the problem, or labeling the tracing without review is outside proper procedure. Question 30. After confirming the patient's identity, a patient is going home with a Holter monitor while communicating with the care team. Which instruction is important? Option A, take a shower with the monitor unless told otherwise. Option B, avoid writing down chest discomfort. Option C, keep a diary of symptoms and activities during monitoring. Option D, remove the electrodes whenever symptoms occur. The correct answer is option C, keep a diary of symptoms and activities during monitoring. A symptom and activity diary helps correlate patient experiences with recorded heart rhythm data. Removing electrodes, getting the device wet against instructions, or failing to note symptoms reduces the usefulness of the test. Question 31. After confirming the patient's identity, a regular EKG rhythm has 4 large boxes between our waves for a patient asking for clarification. Which approximate heart rate is calculated using the 300 method? Option A, 75 beats per minute. Option B, 300 beats per minute. Option C, 120 beats per minute. Option D, 40 beats per minute. The correct answer is option A, 75 beats per minute. For a regular rhythm, dividing 300 by the number of large boxes gives an estimate, so 300 divided by 4 equals 75. The other values do not match the 300 method for 4 large boxes. Question 32. In a medical assistant certification review scenario, a 12-lead EKG requires limb electrodes. Which label belongs on the right arm area? Option A, V4. Option B, LA. Option C, RA. Option D, LL. The correct answer is option C, RA. RA identifies the right arm limb electrode location. LA and LL refer to other limb leads, while V4 is a chest lead rather than a right arm label. Question 33. A medical assistant reviews a case where a urine drug screen requires legal chain of custody handling after the patient asks a follow-up question. Which action is essential? Option A, let the patient take the specimen home overnight. Option B, document specimen control and signatures at each transfer. Option C, leave the specimen unlabeled in the bathroom. Option D, use a routine sticky note instead of required forms. The correct answer is option B, document specimen control and signatures at each transfer. Chain of custody documents who handled the specimen and helps preserve legal validity. Unlabeled storage, patient transport outside protocol, or informal notes break the required control process. Question 34. A medical assistant reviews a case where a patient preparing for a cardiac stress test asks what symptoms to report for a patient waiting for the provider. Which symptom should be reported immediately? Option A, hunger after skipping breakfast. Option B, chest pain, severe shortness of breath, dizziness, or feeling faint. Option C, preference for a different magazine. Option D, mild boredom with waiting. The correct answer is option B, chest pain, severe shortness of breath, dizziness, or feeling faint. Chest pain, severe dyspnea, dizziness, and faintness can signal serious exercise intolerance or cardiac stress. Boredom, reading preferences, and routine hunger may be addressed but are not the urgent stress test warning symptoms. Question 35. During a skills check, The scenario states that a patient is scheduled for an antibiotic injection. Which step is essential before administration? Option A, assume no allergy if the patient is young. Option B, ask about allergies and check the record for documented reactions. Option C, give half the dose without checking. Option D, ask only whether the patient likes injections. The correct answer is option B, ask about allergies and check the record for documented reactions. Medication allergies must be assessed before administration because reactions can be serious. Age, arbitrary dose changes, or preferences about injections do not replace allergy verification. Question 36. After confirming the patient's identity, a medication is ordered by the subcutaneous route while maintaining privacy. Where is the medication intended to be placed? Option A, into the fatty tissue beneath the skin. Option B, into the outer layer of bone. Option C, into the spinal canal. Option D, directly into a vein. The correct answer is option A, into the fatty tissue beneath the skin. Subcutaneous injections deliver medication into the tissue layer beneath the skin and above muscle. Intravenous, bone, and spinal routes are different procedures with different risks and training requirements. Question 37. For a patient scheduled for a procedure in an outpatient setting, a patient brings several prescription bottles to a visit for a patient scheduled for a procedure. What is the purpose of medication reconciliation? Option A, record only medications purchased at the clinic. Option B, replace the provider's medication review. Option C, throw away medications that look old without asking. Option D, compare all current medications to identify omissions, duplications, or interactions. The correct answer is option D. Compare all current medications to identify omissions, duplications, or interactions. Medication reconciliation creates an accurate medication list and helps identify potential safety concerns. Discarding medications, replacing the provider's role, or omitting outside prescriptions can create incomplete information. Question 38. A medical assistant reviews a case where a caller reports crushing chest pain and shortness of breath. Which response is appropriate? Option A, diagnose indigestion over the phone. Option B, tell the caller to drive alone to the clinic. Option C, follow emergency protocol and direct the caller to emergency services as instructed by policy. Option D, schedule a routine visit next month. The correct answer is option C. Follow emergency protocol and direct the caller to emergency services as instructed by policy. Chest pain with shortness of breath may be an emergency and should be managed using established protocols. Delaying care, advising unsafe transport, or diagnosing by phone is outside the medical assistant role. Question 39. For a pediatric patient in an outpatient setting, a medication list includes atorvastatin during clinical workflow. Which medication class does this represent? Option A, diuretic used to increase urine output. Option B, a bronchodilator used for acute wheezing only. Option C, statin used to lower cholesterol. Option D, anticoagulant used to dissolve clots instantly. The correct answer is option C, statin used to lower cholesterol. Atorvastatin is a statin used to help manage cholesterol levels. Diuretics, anticoagulants, and bronchodilators have different purposes and mechanisms. Question 40. While preparing the exam room, a patient uses an albuterol inhaler for wheezing for a patient in the exam room. What is the intended effect? Option A, lower cholesterol over months. Option B, destroy bacteria in the stomach. Option C, increase blood clotting. Option D, relax airway smooth muscle to improve airflow. The correct answer is option D, relax airway smooth muscle to improve airflow. Albuterol is a bronchodilator that opens airways and can relieve bronchospasm. Blood clotting, cholesterol control, and bacterial destruction are unrelated medication effects. Question 41. For a pediatric patient in an outpatient setting, a controlled medication is stored in the clinic. Which practice supports accountability? Option A, keep it unlocked for convenience. Option B, document receipt, administration, waste, and remaining count according to policy. Option C, let patients sign it out themselves. Option D, estimate the count once a year. The correct answer is option B, document receipt, administration, waste, and remaining count according to policy. Controlled substances require strict documentation and secure handling to prevent diversion and errors. unlocked storage, infrequent estimates, or patient self-checkout would break accountability requirements. Question 42. While following clinic policy, the medical assistant notes that a patient takes several products for cold symptoms and pain after reviewing the order. Which concern should be reviewed with acetaminophen? Option A. It always causes bacterial resistance. Option B. It should be taken only by injection. Option C. Accidental duplicate dosing can increase liver injury risk. Option D. It replaces all vaccines. The correct answer is option C. Accidental duplicate dosing can increase liver injury risk. Many over-the-counter products contain acetaminophen, so duplicate dosing can exceed safe daily limits and harm the liver. It does not cause antibiotic resistance, replace vaccines, or require injection use. Question 43. During a skills check, the scenario states that the medical assistant needs to measure respirations after taking a pulse for a patient in the exam room. Which technique is most appropriate? Option A. Count only one breath and multiply by 60. Option B. Ask the patient to hold their breath between counts. Option C. Continue holding the wrist and count respirations without alerting the patient. Option D. Tell the patient to breathe faster while counting. The correct answer is option C. Continue holding the wrist and count respirations without alerting the patient. Respirations are often counted discreetly because patients may change their breathing pattern when they know it is being observed. Coaching the breathing, counting one breath, or interrupting the breathing pattern produces inaccurate results. Question 44. A provider asks for assistance because a vaccine vial is selected from storage. Which check must be performed before administration? Option A. Warm it on a windowsill for the day. Option B. Use it if the label color looks familiar. Option C. Ignore storage logs if the patient is waiting. Option D. Confirm the expiration date and storage conditions. The correct answer is option D. Confirm the expiration date and storage conditions. Expiration date and storage conditions affect medication safety and effectiveness. Label familiarity, warming on a windowsill, or ignoring logs can lead to administering an unusable product. Question 45. After confirming the patient's identity, a term contains the combining form CARDI/O while supporting safe patient care. Which body structure is referenced? Option A. Kidney. Option B. Skin. Option C. Stomach. Option D. Heart. The correct answer is option D. Heart. CARDI/O refers to the heart and appears in terms such as cardiology and cardiogram. Kidney, stomach, and skin use different word parts. Question 46. A provider asks for assistance because a pulse rate is documented as tachycardic for a patient who appears anxious. Which finding is being described? Option A. Low body temperature. Option B. Slow breathing only. Option C. The inflammation of the stomach. Option D. Faster than normal heart rate. The correct answer is option D. Faster than normal heart rate. Tachycardia describes an abnormally fast heart rate for the patient's situation. Low temperature, slow respirations, and stomach inflammation are different concepts. Question 47. When preparing safe patient care, a diabetic patient is shaky, sweating, and confused before lunch. Which condition should be considered? Option A. Hyperopia. Option B. Dermatitis only. Option C. Otitis media. Option D. Hypoglycemia. The correct answer is option D. Hypoglycemia. Shaking, sweating, and confusion can occur with low blood glucose, especially when meals are delayed. Vision farsightedness, middle ear infection, and skin inflammation do not best match this symptom pattern. Question 48. During a skills check, the scenario states that an insurance plan pays 80% and the patient is responsible for 20% after the deductible while following standard precautions. Which term describes the patient portion? Option A. Sterilization. Option B. Coinsurance. Option C. Chief complaint. Option D. Capitation only. The correct answer is option B. Coinsurance. Coinsurance is a percentage share of allowed costs paid by the patient. Chief complaint, capitation, and sterilization describe different clinical or payment concepts. Question 49. At the front desk handoff, a returning patient is involved when a patient asks what the kidneys do for a returning patient. Which response is accurate? Option A. Pump blood through arteries. Option B. Produce bile for fat digestion. Option C, filter waste from blood and help regulate fluid balance. Option D, exchange oxygen in the alveoli. The correct answer is option C, filter waste from blood and help regulate fluid balance. The kidneys filter blood, form urine, and help regulate fluid and electrolyte balance. Bile production, gas exchange, and blood pumping are liver, lung, and heart functions. Question 50. In a medical assistant certification review scenario, a study question asks about bile production. Which organ is primarily responsible? Option A, adrenal gland. Option B, bladder. Option C, appendix. Option D, liver. The correct answer is option D, liver. The liver produces bile, which helps with fat digestion after storage and release through the biliary system. The appendix, bladder, and adrenal gland have different roles. Question 51. During an annual wellness visit, a teen patient is involved when a medication note refers to hypotension while checking the chart. What does hypo mean? Option A, before birth. Option B, below normal or low. Option C, between ribs. Option D, above normal. The correct answer is option B, below normal or low. Hypo means low or below normal, so hypotension means low blood pressure. Above normal, between ribs, and before birth use different prefixes. Question 52. For a new patient in an outpatient setting, a patient describes dysuria for a new patient. What does dys usually indicate? Option A, normal. Option B, without. Option C, difficult or painful. Option D, after meals. The correct answer is option C, difficult or painful. Dys often means difficult, painful, or abnormal, so dysuria is painful or difficult urination. Normal, without, and after meals are represented by different word parts. Question 53. After confirming the patient's identity, a procedure name ends in ectomy. What does the suffix mean? Option A, paralysis. Option B, inflammation. Option C, surgical removal. Option D, enlargement. The correct answer is option C, surgical removal. Ectomy means surgical removal, such as appendectomy. Inflammation, paralysis, and enlargement use different suffixes. Question 54. During a geriatric visit, a patient with diabetes is involved when an anatomy diagram divides the body into left and right portions during a quality control check. Which plane is shown? Option A, sagittal plane. Option B, frontal plane. Option C, transverse plane. Option D, the oblique medication route. The correct answer is option A, sagittal plane. The sagittal plane divides the body into left and right portions. Transverse divides upper and lower. Frontal divides front and back, and oblique medication route is not an anatomical plane. Question 55. While training a new medical assistant, a patient is lying face down on the exam table for a patient in the exam room. Which term describes this position? Option A, prone. Option B, Fowler. Option C, supine. Option D, Trendelenburg. The correct answer is option A, prone. Prone means lying face down. Supine is face up. Fowler is seated with the head elevated, and Trendelenburg positions the head lower than the feet. Question 56. During a certification-style scenario, a patient with limited mobility is involved when a patient has fatigue, cold intolerance, and weight gain with low thyroid activity. Which condition is suggested? Option A, otitis media. Option B, tachycardia only. Option C, hyperventilation. Option D, hypothyroidism. The correct answer is option D, hypothyroidism. Hypothyroidism reflects reduced thyroid hormone activity and can slow metabolism. Hyperventilation, middle ear infection, and fast heart rate do not match the low thyroid pattern described. Question 57. When preparing safe patient care, a patient has swelling in the ankles from excess fluid in tissues while preventing documentation errors. Which term applies? Option A, cyanosis. Option B, hematuria. Option C, edema. Option D, diplopia. The correct answer is option C, edema. Edema is swelling caused by fluid accumulation in tissues. Cyanosis, hematuria, and diplopia refer to bluish discoloration, blood in urine, and double vision. Question 58. After confirming the patient's identity, A patient with limited English proficiency needs discharge teaching for a patient scheduled for a procedure. Which approach is best? Option A, speak louder in English only. Option B, use a qualified medical interpreter according to policy. Option C, skip teaching because interpretation takes time. Option D, ask a young child to interpret sensitive information. The correct answer is option B, use a qualified medical interpreter according to policy. Qualified interpreters improve accuracy, confidentiality, and patient understanding. Children, louder speech, or skipped teaching can cause errors and ethical concerns. Question 59. After confirming the patient's identity, a patient's insurance requires approval to see a specialist. Which document or process may be needed? Option A, referral. Option B, medication lot sticker. Option C, inventory count sheet. Option D, autoclave log only. The correct answer is option A, referral. A referral authorizes or documents the need for specialty care under many insurance plans. Inventory sheets, sterilization logs, and lot stickers do not authorize specialty visits. Question 60. During a skills check, the scenario states that a patient pays a fixed amount at each office visit under the insurance plan while preventing documentation errors. Which term describes this payment? Option A, premium refund. Option B, copayment. Option C, relative value unit. Option D, deductible only. The correct answer is option B, copayment. A copayment is a fixed patient payment due for a covered service. A deductible, premium refund, and relative value unit describe other financial or coding concepts. Question 61. During a skills check, the scenario states that an insurance plan pays 80% and the patient is responsible for 20% after the deductible for a pediatric patient. Which term describes the patient portion? Option A, chief complaint. Option B, coinsurance. Option C, capitation only. Option D, sterilization. The correct answer is option B, coinsurance. Coinsurance is a percentage share of allowed costs paid by the patient. Chief complaint, capitation, and sterilization describe different clinical or payment concepts. Question 62. At a preventive care appointment, a new patient is involved when a claim needs a code for an office procedure performed by the provider. Which code set is commonly used? Option A, ICD-10-CM. Option B, CPT. Option C, Advanced Directive. Option D, alphabetic filing. The correct answer is option B, CPT. CPT codes describe medical procedures and services for billing. ICD-10-CM diagnoses, filing systems, and advanced directives do not code the service performed. Question 63. For a teen patient in an outpatient setting, a patient with shortness of breath is waiting to be evaluated while preparing for provider review. Which position may help breathing while waiting? Option A, Trendelenburg position with the head lowered. Option B, Fowler position with the head of the bed elevated. Option C, prone position with the face down. Option D, lithotomy position with feet in stirrups. The correct answer is option B, Fowler position with the head of the bed elevated. Fowler position can promote chest expansion and may ease breathing for many patients with dyspnea. Prone, Trendelenburg, and lithotomy positions are used for different purposes and can be inappropriate for shortness of breath. Question 64. A provider asks for assistance because Medicare may not cover a service and the patient must be informed before it is performed for a patient with limited mobility. Which form may be needed? Option A, Pediatric Growth Chart. Option B, Daily Appointment Reminder Card. Option C, Advance Beneficiary Notice. Option D, the Bloodborne Pathogen Log. The correct answer is option C, Advance Beneficiary Notice. An advance beneficiary notice informs a Medicare patient that a service may not be covered and that they may be financially responsible. Exposure logs, growth charts, and reminder cards do not serve this financial notice purpose. Question 65. While following clinic policy, the medical assistant notes that a patient wants lab results through an online system. Which feature supports secure access? Option A, a hallway bulletin board. Option B, a public social media comment. Option C, a group text to unrelated patients. Option D, a patient portal with identity verification and secure messaging. The correct answer is option D, a patient portal with identity verification and secure messaging. A patient portal is designed to give patients secure access to health information and communication. Social posts, bulletin boards, and unrelated group texts expose protected information. Question 66. In a medical assistant certification review scenario, the provider blocks lunch, meetings, and procedure times before booking patients before documentation is completed. Which scheduling method is being used? Option A, biohazard scheduling. Option B, matrix scheduling. Option C, sterile scheduling only. Option D, a random scheduling. The correct answer is option B, matrix scheduling. Matrix scheduling blocks unavailable or reserved times so appointments are not placed there. Random, biohazard, and sterile scheduling are not standard appointment scheduling methods. Question 67. During a certification-style scenario, a patient scheduled for a procedure is involved when two patients are placed in the same appointment slot for a patient scheduled for a procedure. What is this called? Option A, downcoding only. Option B, capillary puncture. Option C, closed filing. Option D, double booking. The correct answer is option D, double booking. Double booking schedules more than one patient in the same time slot and should be used carefully according to policy. Capillary puncture, filing, and downcoding are unrelated terms. Question 68. After confirming the patient's identity, a patient requests correction of information in the medical record during clinical workflow. Which action is appropriate? Option A, change another patient's chart instead. Option B, follow the facility process for an amendment or addendum. Option C, tell the patient records can never be reviewed. Option D, erase the original entry without documentation. The correct answer is option B, follow the facility process for an amendment or addendum. Medical records are corrected through formal amendment or addendum processes that preserve integrity. Erasing entries, refusing all review, or altering the wrong chart is improper. Question 69. At a new patient intake, a billing call is made about an overdue balance for a returning patient. Which practice protects privacy? Option A, verify the patient's identity before discussing account details. Option B, discuss the balance with anyone who answers. Option C, announce the debt in the waiting room. Option D, leave detailed diagnosis information on a shared voicemail. The correct answer is option A, verify the patient's identity before discussing account details. Identity verification helps protect financial and health information during billing conversations. Sharing details with unknown persons, detailed shared voicemail, or public announcements violates privacy. Question 70. During a skills check, the scenario states that a patient has questions about risks before a minor procedure. Who should answer clinical risk questions for informed consent? Option A, a random patient in the lobby. Option B, the receptionist only. Option C, the provider performing or ordering the procedure. Option D, the medical assistant by guessing. The correct answer is option C, the provider performing or ordering the procedure. The provider is responsible for explaining risks, benefits, and alternatives so the patient can give informed consent. Reception staff, other patients, or guest explanations do not meet informed consent standards. Question 71. While reviewing office protocol, a procedure is performed after the patient clearly refuses touching while maintaining privacy. Which legal concern may apply? Option A, battery. Option B, defamation only. Option C, capitation. Option D, abandonment only. The correct answer is option A, battery. Battery involves unauthorized physical contact and can occur when touching continues after refusal. Defamation, abandonment, and capitation refer to different legal or payment concepts. Question 72. Before the provider enters the room, a claim needs a code for the patient's diagnosis for a patient in the exam room. Which code set is used? Option A, ICD-10-CM. Option B, NDC only. Option C, CPT only. Option D, HCPCS Level 2 only. The correct answer is option A, ICD-10-CM. ICD-10-CM codes describe diagnoses and reasons for encounters. CPT, HCPCS Level 2, and NDC identify procedures, supplies, or drug products rather than diagnoses. Question 73. A provider asks for assistance because a patient has written instructions about future medical care if unable to speak. Which document is this? Option A, Superbill. Option B, Autoclave Indicator. Option C, Daily Deposit Slip. Option D, Advance Directive. The correct answer is option D, Advance Directive. An advance directive communicates care preferences for future situations when the patient may be unable to decide. Billing, sterilization, and deposit documents do not express medical wishes. Question 74. After confirming the patient's identity, a patient uses a traditional health practice unfamiliar to the medical assistant after the patient asks a follow-up question. Which response is best? Option A, ignore it even if it may affect care. Option B, tell the patient to stop without provider input. Option C, ask respectful, non-judgmental questions and share relevant information with the provider. Option D, ridicule the practice in the chart. The correct answer is option C, ask respectful, non-judgmental questions and share relevant information with the provider. Cultural competence involves respectful curiosity and accurate communication that supports safe care. Ridicule, unsupported instructions, or ignoring relevant practices can damage trust and miss safety issues. Question 75. A provider asks for assistance because a patient is anxious about a procedure for a patient with hypertension. Which behavior shows active listening? Option A, tell the patient anxiety is silly. Option B, interrupt to finish the patient's sentences. Option C, maintain appropriate eye contact and summarize the patient's concern. Option D, look away and type unrelated notes. The correct answer is option C, maintain appropriate eye contact and summarize the patient's concern. Active listening uses attention, reflection, and clarification to show the patient was heard. Interrupting, disengaging, or minimizing feelings can increase anxiety and reduce trust. Question 76. During a skills lab scenario, a patient says they are scared about a biopsy result. Which response is therapeutic? Option A, everyone gets scared, so stop worrying. Option B, I know for sure nothing is wrong. Option C, you should not ask questions. Option D, that sounds frightening, I can let the provider know you have concerns. The correct answer is option D, that sounds frightening, I can let the provider know you have concerns. An empathetic response acknowledges feelings and offers appropriate support without giving false reassurance. Dismissing fear, guaranteeing results, or discouraging questions is not therapeutic. Question 77. After confirming the patient's identity, a patient drank hot coffee immediately before an oral temperature is planned while following standard precautions. Which action should the medical assistant take? Option A, ask the patient to sip cold water to balance the reading. Option B, use the same probe cover for a repeat reading. Option C, wait before taking the oral temperature or use an approved alternate route. Option D, record the temperature immediately because coffee has no effect. The correct answer is option C, wait before taking the oral temperature or use an approved alternate route. Hot or cold intake can temporarily alter oral temperature readings, so waiting or using an approved alternate route improves accuracy. Immediate measurement, reused covers, or trying to offset the effect with another drink can create unreliable data and poor infection control. Question 78. For a patient with diabetes in an outpatient setting, a child has injuries that raise reasonable suspicion of abuse for a patient with diabetes. Which action is appropriate? Option A, follow mandatory reporting and office policy immediately. Option B, ignore it because reporting is uncomfortable. Option C, ask the suspected abuser for permission to report. Option D, post pictures online to get opinions. The correct answer is option A, follow mandatory reporting and office policy immediately. Healthcare workers may have mandatory reporting duties when abuse is suspected, depending on law and policy. Ignoring signs, seeking permission from a suspected abuser, or posting information online is unsafe and inappropriate. Question 79. After confirming the patient's identity, an office policy emphasizes avoiding preventable patient harm. Which ethical principle is involved? Option A, non-maleficence. Option B, downcoding. Option C, respondeat copying. Option D, capitation. The correct answer is option A, non-maleficence. Non-maleficence means avoiding harm and is central to safe healthcare practice. Capitation and downcoding are payment or coding terms, while the third option is not a valid ethical principle. Question 80. A provider asks for assistance because a clinic applies appointment policies fairly to all patients after noticing a potential safety concern. Which ethical principle is reflected? Option A, justice. Option B, polyuria. Option C, hemolysis. Option D, tachycardia. The correct answer is option A, justice. Justice involves fairness and equitable treatment. Tachycardia, hemolysis, and polyuria are clinical terms rather than ethical principles. Question 81. In a medical assistant certification review scenario, a patient becomes angry about a long wait for a patient waiting for the provider. Which response is best? Option A, mock the patient's concern. Option B, use a calm voice, acknowledge the frustration, and offer to check the status. Option C, argue loudly in front of other patients. Option D, threaten to cancel care immediately without policy. The correct answer is option B. Use a calm voice, acknowledge the frustration, and offer to check the status. De-escalation uses calm communication and problem-solving to reduce tension. Arguing, mocking, or threatening without policy can escalate the situation and harm the patient relationship. Question 82. When preparing safe patient care, the medical assistant needs to measure respirations after taking a pulse. Which technique is most appropriate? Option A, tell the patient to breathe faster while counting. Option B, count only one breath and multiply by 60. Option C, continue holding the wrist and count respirations without alerting the patient. Option D, ask the patient to hold their breath between counts. The correct answer is option C, continue holding the wrist and count respirations without alerting the patient. Respirations are often counted discreetly because patients may change their breathing pattern when they know it is being observed. Coaching the breathing, counting one breath, or interrupting the breathing pattern produces inaccurate results. Question 83. When preparing safe patient care, a conscious diabetic patient is shaky and has a low glucose reading after noticing a potential safety concern. Which action is generally appropriate by protocol? Option A, tell the patient to exercise vigorously. Option B, administer a random antibiotic. Option C, give nothing and send the patient to drive home. Option D, provide a fast-acting carbohydrate if allowed by office policy. The correct answer is option D, provide a fast-acting carbohydrate if allowed by office policy. A conscious patient with low glucose may need fast-acting carbohydrate according to protocol. Driving, antibiotics, or vigorous exercise can worsen the situation or fail to treat hypoglycemia. Question 84. A provider asks for assistance because a patient has a bleeding laceration while waiting for the provider for a patient who appears anxious. Which first aid step is appropriate? Option A, use bare hands to hold the wound. Option B, apply direct pressure with appropriate protection. Option C, apply heat to increase bleeding. Option D, remove large embedded objects aggressively. The correct answer is option B, apply direct pressure with appropriate protection. Direct pressure with PP helps control bleeding and protects the responder. Removing embedded objects, using bare hands, or applying heat can worsen bleeding or exposure risk. Question 85. A medical assistant reviews a case where a patient twists an ankle in the parking lot. Which first aid concept may be used initially? Option A, rest, ice, compression, and elevation as appropriate. Option B, sterilize the ankle in an autoclave. Option C, ignore swelling until next year. Option D, heat, running, and deep massage immediately. The correct answer is option A, rest, ice, compression, and elevation as appropriate. Initial sprain care often uses rest, ice, compression, and elevation to reduce swelling and protect the area. Heat, running, ignoring symptoms, or autoclaving are inappropriate. Question 86. When preparing safe patient care, a patient is pale, cool, clammy, and confused after an injury while following standard precautions. Which condition is a concern? Option A, otitis externa. Option B, acne. Option C, myopia. Option D, shock. The correct answer is option D, shock. Pale, cool skin, clamminess, and confusion after injury can indicate shock and require urgent response. Nearsightedness, ear canal infection, and acne do not explain this emergency pattern. Question 87. During a skills check, the scenario states that a patient reports burning during urination and urinary frequency for a teen patient. Which condition may be suspected? Option A, myopia. Option B, otitis externa. Option C, urinary tract infection. Option D, sprained ankle only. The correct answer is option C, urinary tract infection. Burning with urination and frequency are common symptoms associated with urinary tract infection. Ear canal infection, nearsightedness, and ankle injury do not best explain urinary symptoms. Question 88. A medical assistant reviews a case where a disinfectant splashes into a staff member's eye. Which first response is appropriate? Option A, cover it and wait until tomorrow. Option B, use hand sanitizer in the eye. Option C, flush the eye with water or eye wash for the recommended time and report the exposure. Option D, rub the eye hard to remove chemical. The correct answer is option C, flush the eye with water or eye wash for the recommended time and report the exposure. Chemical eye exposure requires immediate flushing and reporting according to the safety data sheet and facility policy. Rubbing, delaying, or adding sanitizer can worsen injury. Question 89. During a routine office visit, a sterile tray is prepared for a minor procedure while checking the chart. Which action maintains sterility? Option A, use items from a wet torn package. Option B, keep sterile items above waist level and within view. Option C, reach over the field with non-sterile sleeves. Option D, turn away from the sterile field for several minutes. The correct answer is option B, keep sterile items above waist level and within view. Sterile fields must remain visible and protected from contamination. Turning away, reaching over the field, or using compromised packages can contaminate supplies. Question 90. A provider asks for assistance because a dressing change is being performed on a draining wound for a patient asking for clarification. Which action is appropriate? Option A, place soiled dressings on the clean supply tray. Option B, use clean or sterile technique as ordered and dispose of soiled dressings properly. Option C, reuse old tape to save supplies. Option D, document the wound before assessing it. The correct answer is option B, use clean or sterile technique as ordered and dispose of soiled dressings properly. Dressing changes require technique appropriate to the order and safe disposal of contaminated materials. Placing soiled items with clean supplies, reusing tape, or documenting before assessment can create infection and accuracy problems. Question 91. During a skills check, the scenario states that a Snellen chart is used during screening. Which function is being assessed? Option A, hearing threshold. Option B, blood glucose average. Option C, distance visual acuity. Option D, blood clotting time. The correct answer is option C, distance visual acuity. A Snellen chart screens how clearly a patient sees at a distance. Hearing, coagulation, and glucose control require different tests. Question 92. A medical assistant reviews a case where paper charts are filed alphabetically while working under provider supervision. Which name is usually used first? Option A, favorite color. Option B, street number only. Option C, patient's last name. Option D, appointment room number. The correct answer is option C, patient's last name. Alphabetic filing generally starts with the patient's last name to maintain consistent record organization. Color preferences, street numbers, and room numbers do not provide reliable alphabetic indexing. Question 93. When preparing safe patient care, ear irrigation is ordered for cerumen removal for a patient with diabetes. Which precaution is important? Option A, use very hot water to dissolve wax quickly. Option B, verify the order and screen for contraindications such as ear pain or perforation history. Option C, proceed even if the patient reports severe ear pain. Option D, aim forcefully at the eardrum. The correct answer is option B, verify the order and screen for contraindications such as ear pain or perforation history. Ear irrigation requires appropriate order, temperature, and screening because perforation or infection can make irrigation unsafe. Hot water, forceful aiming, or ignoring pain can injure the patient. Question 94. While following clinic policy, the medical assistant notes that a pelvic exam is being prepared. Which action supports patient comfort and privacy? Option A, invite unrelated staff to observe. Option B, leave the patient uncovered until the provider arrives. Option C, discuss private details loudly outside the room. Option D, provide appropriate draping and explain each step within the assistant's role. The correct answer is option D, provide appropriate draping and explain each step within the assistant's role. Draping and respectful explanations protect dignity and reduce anxiety. Unnecessary exposure, unrelated observers, and loud discussion violate privacy. Question 95. While following clinic policy, the medical assistant notes that a patient asks detailed questions about a new diagnosis while communicating with the care team. Which action is appropriate for the medical assistant? Option A, create a personal treatment plan without provider input. Option B, tell the patient not to research anything. Option C, change the diagnosis in the chart. Option D, provide approved educational materials and refer diagnosis questions to the provider. The correct answer is option D, provide approved educational materials and refer diagnosis questions to the provider. Medical assistants can reinforce approved education but should refer diagnosis and treatment decisions to the provider. Independent treatment planning, discouraging questions, or changing diagnoses exceeds the role. Question 96. While following clinic policy, the medical assistant notes that a warm compress is ordered for a localized muscle strain for a pediatric patient. Which action supports safety? Option A, check temperature and skin condition before and during application. Option B, apply maximum heat to speed healing. Option C, use heat over numb skin without monitoring. Option D, place it over a medication patch. The correct answer is option A, check temperature and skin condition before and during application. Heat therapy requires temperature checks and skin monitoring to prevent burns. Excessive heat, numb skin without monitoring, or use over patches can cause injury or alter medication absorption. Question 97. While assisting with patient care, a reusable surgical instrument must be free of all microorganisms including spores. Which process is required? Option A, plain water rinsing. Option B, sanitization only. Option C, sterilization. Option D, routine dusting. The correct answer is option C, sterilization. Sterilization destroys all forms of microbial life including spores when performed correctly. Sanitizing, dusting, or rinsing lowers visible soil or some organisms but does not make an instrument sterile. Question 98. During a certification-style scenario, the medical assistant needs to measure respirations after taking a pulse while following standard precautions. Which technique is most appropriate? Option A, ask the patient to hold their breath between counts. Option B, tell the patient to breathe faster while counting. Option C, continue holding the wrist and count respirations without alerting the patient. Option D, count only one breath and multiply by 60. The correct answer is option C, continue holding the wrist and count respirations without alerting the patient. Respirations are often counted discreetly because patients may change their breathing pattern when they know it is being observed. Coaching the breathing, counting one breath, or interrupting the breathing pattern produces inaccurate results. Question 99. For a patient waiting for the provider in an outpatient setting, a pulse oximeter is not giving a steady reading on a patient with cold fingers for a patient waiting for the provider. Which action should the medical assistant try first? Option A, apply the sensor over dark nail polish without adjustment. Option B, ignore the reading because pulse oximetry is optional. Option C, warm the finger and ensure the sensor is positioned correctly. Option D, place the probe on a moving hand during conversation. The correct answer is option C, warm the finger and ensure the sensor is positioned correctly. Cold extremities and poor sensor placement can interfere with pulse oximeter detection. Nail polish, movement, and ignoring an unstable reading can all lead to inaccurate oxygen saturation documentation. Question 100. When preparing safe patient care, an adult patient is asked to rate pain during intake after confirming office policy. Which documentation is most appropriate? Option A, pain level of 7 on a 0 to 10 scale with location and quality. Option B, no pain score needed because vital signs are normal. Option C, pain is bad because the patient looks uncomfortable. Option D, patient probably exaggerates pain. The correct answer is option A, pain level of 7 on a 0 to 10 scale with location and quality. Pain is subjective and should be documented using the patient's stated rating along with useful details such as location and quality. Judgments, assumptions, and ignoring pain because other vital signs are normal fail to capture the patient's report.